In this video, we will discuss about core concepts regarding the local anesthetics. Local anesthetics. So here we have the two terms. One is the local, other one is the anesthetics. Local means particular region in the body. Particular region in the body or specific area in the body, we say. Anesthetics means loss of sensation. They causes the loss of sensation. Local anesthetic means in the particular region of the body, it causes the loss of sensation. That is what the local anesthetics. Now the question is, who is responsible for causing the sensation? Yes. So this is the body. This is the body. And this is the brain. This is the brain. And here we are having the peripheral nerves. Peripheral nerves. So peripheral nerves transmitting the sensory information from the body to the brain. Peripheral nerves transmitting the sensory information from the body to the brain. And this is done by the one of the channel called sodium ion channel. So the sodium ion channel present in the peripheral nerves. So this sodium ion channel transmitting the information from the body to the brain. Then person will get the sensation. Now what we want to do? Yes, we want to inhibit is the sodium ion channel. By inhibiting the sodium ion channel, the information cannot pass from the body to the brain. So we will get the loss of sensation and produces the local anesthesia. Now another thing, if you look at local anesthetics, these all drugs name end with the caine. Local anesthetic, all drugs name end with the caine. And this caine, they contains the INE. Most of the times, if the drug name end with the INE, they are the basic nature. Because most of the time, they contain is the NH2. They contain is the amine. In the amine, nitrogen contains the lone pair of electron. They can donate this lone pair of electron. After donating the lone pair of electron, it starts behaving like a basic nature. So simple language, wherever the NH2 is present, that means they are the basic nature. So local anesthetics, their name end with the INE, they are the basic nature. Not only this one, you can take the dopamine. INE, they contains directly amine, basic nature. For example, epinephrine. Epinephrine. INE, they are the basic nature. They contain the INE, NH2 is present. Let's say morphine. Name end with the INE. They contain the nitrogen, basic nature. Let's take the D-tubocorarine. So this name also end with the INE. They contain the nitrogen and they are the basic nature. In simple language, most of the time, if the drug name end with the INE, basic nature. Even I can say the one more example, chloroquine. INE contains the nitrogen, basic nature. Here, local anesthetic also having the basic nature. Okay? But local anesthetics are the weak bases. They are the weak bases. By keeping the local anesthetic in the basic solutions, we can make the more lipid solubility, more lipophilic, When the drug becomes the more lipophilic, that means it is the unionized form. Unionized form. So if the drug is the unionized form, it can easily cross the axonal membrane and it will reaches the sodium ion channel easily. Then they can block the sodium ion channel. Very important thing is, let's say this is the axon, and in this axon here we are having the sodium ion channel. When you give the local anesthetics by adding the basic solution like a sodium bicarbonate. So what is the basic solution we will add here? That is the sodium bicarbonate. Then our drug becomes the more lipophilic. Then this more lipophilic drug, it will cross the axonal membrane easily. Then in the axonal membrane, the drug becomes the ionized form. And this ionized form, it will bind to the sodium ion channel and inhibits the sodium ion channel. And finally, we will get the loss of sensation. Loss of sensation. So, which solution we are adding to the local anesthetic sodium bicarbonate for easily cross the barriers. After crossing easily barriers, then in the axona, it will becomes the ionized and it will inhibit the sodium ion channel. So that is what the mechanism of action of the local anesthetics. Why we add the sodium bicarbonate? To make the more lipid solubility. Okay. Now apart from that, in the local anesthetic, one thing we will add here, sodium bicarbonate. That is a basic solution. The other thing we will add here, adrenaline. Adrenaline. Why we add the adrenaline to the local anesthetics? What is the reason? Understand? Suppose this is the injured place. Okay, this is the injured place. We want to suture. Can I directly suture it? Obviously no. Why? If I directly inject the needle, we will get the severe pain. Already injured. By directly injecting the needle, we will get the severe pain. We don't want that. What I will do here? Yes, I will give the local anesthetic, make the loss of sensation at this place so that we can suture it. Isn't it? Now, this is the subcutaneous route. This subcutaneous route contains the blood vessel. Whenever I give the local anesthetic this place, and local anesthetic will come. Through this blood vessel, local anesthetic will reaches the blood. After reaching the blood, it causes the systemic toxicity. It causes the systemic toxicity. We don't want this. So here, local anesthetic should present this region only. Then only we will causes the loss of sensation. Then we can produce as the anesthesia. But local anesthetic, after giving by subcutaneous route, through this blood vessel, it is coming to the blood. It is reaching the blood, causing the systemic toxicity, causing the systemic absorption. So we don't want this. Now what I do, I will add the adrenaline. I will add the adrenaline. Adrenaline is sympathomimetic drug. What it causes? It causes the vasoconstriction of this blood vessel. Whenever it causes the vasoconstriction of this blood vessel, then the local anesthetic cannot go. To the blood. it is present here only, then we will get the anesthesia. So that is the reason why we add the adrenaline. The two important things, we want the local anesthetic this place only, it is present here only. The another thing we can inhibit is the systemic toxicity. So that's why we add the adrenaline. But here again two important things. Local anesthetics में adrenaline solution we don't add in the cocaine. The local anesthetic name called cocaine. Why? Cocaine itself having the vasoconstriction property. Cocaine itself having the vasoconstriction property. That's why. So to the cocaine solution, we don't add the adrenaline. If you add the adrenaline, it causes the severe vasospasm that can lead to the severe side effect. So that's why we don't add the adrenaline in the cocaine solution. Remaining all solutions, we can add the adrenaline. Okay. So here, another special point is the sodium bicarbonate we will add in the all local anesthetics to make the lipophilic, to make the more lipophilic. But in one local anesthetic, we don't add the sodium bicarbonate. What is that? Yes, your answer is the right. That is the bupivacaine. Bupivacaine. When we add the sodium bicarbonate into bupivacaine, it causes the precipitate. It causes the precipitate. There is the chemical incompatibility. They are not compatible with each other. It causes the precipitate. That's why we don't add the sodium bicarbonate in bupivacaine solution. Okay. Apart from that, adrenaline we also don't add in the some of the places where adrenaline we don't add. So that you can remember the very famous personality name, call it as the Amit. Okay. So adrenaline we should not add in these type. What is the A? A means arrhythmia. If the patient is suffering with the arrhythmia, we should not add the adrenaline in local anesthetic. M means myocardial infarction. I means intravenous local anesthetic solution. T means tip of surgery. And H means hypertension. So in these conditions, adrenaline we should not add. Adrenaline we should not add. What is that? In arrhythmia, myocardial infarction, intravenous local anesthetic, tip surgery, in the hypertension, adrenaline we should not add. Okay. So what are the local anesthetics we are having? So local anesthetics are classified into two types. One is the ester local anesthetic. Other one is the amide local anesthetics. We know these all drugs name end with the K. These all drugs name end with the K. So ester local anesthetic example: procaine, cocaine, tetracaine, benzocaine. These all are the ester local anesthetics. On the other hand, amide local anesthetics we are having lidocaine. We also call it as the xylocaine. They contain is the xylene moiety. Bupivacaine, ropivacaine, etidocaine, and prilocaine. So these all are the amide local anesthetic. But in the exam, they can ask which of the following is not amide local anesthetic. How will you identify? So you can easily identify. The important trick is, In the amide local anesthetic, we contain is the 2I. Lidocaine, they contain is the 2I. Bupivacaine contain is the 2I. Ropivacaine contain is the 2I. In their name contain is the 2I. Itidocaine and prilocaine. So all amide local anesthetic contain is the 2I. In their name, there are the 2 I's, that is the amide local anesthetic. On the other hand, ester local anesthetic contain is the only 1 I. Only 1 I. If the 1 I is there, that is the ester local anesthetic. So that is what the important concept about the local anesthetics. Thank you everyone.